How do microscopic differences define cervical cancer types? Imagine looking at a tiny universe of cells under a microscope. Each cell tells a story about how a cancer starts and behaves. In cervical cancer, the microscopic details reveal the type of cancer and help guide treatment. The two main types are squamous cell carcinoma and adenocarcinoma, and they are distinguished by the specific cells they originate from and how these cells look under the microscope. Squamous cell carcinoma begins in the flat, skin-like cells that cover the outer part of the cervix, called the ectocervix. When viewed under a microscope, these cancer cells often look abnormal but still resemble squamous cells. They may form irregular groups or sheets of cells invading the tissue. Pathologists look for features like keratin production or intercellular bridges, which are small connections between cells. These features help confirm the diagnosis. Squamous cell carcinoma makes up most of the cervical cancers and is graded based on how much the cancer cells resemble normal squamous cells. Well-differentiated tumors look more like normal cells and tend to grow slowly, while poorly differentiated ones look very abnormal and can grow and spread faster. Adenocarcinoma, on the other hand, starts in the glandular cells lining the cervical canal, which produce mucus. Under the microscope, these cancer cells form gland-like structures or produce mucin, a mucus component. These cells look different from squamous cells because they are more column-shaped and from organized structures resembling glands. Adenocarcinomas account for a smaller but increasing portion of cervical cancers. Like squamous cell carcinoma, they are graded based on how much the cells resemble normal glandular cells, with higher grades indicating more abnormal and potentially more aggressive tumors. There are also less common types, such as adenosquamous carcinoma, which shows features of both glandular and squamous cells, and small cell carcinomas, which contain tiny, densely packed cells with neuroendocrine markers. These rarer types often requiring different treatment approaches because they tend to be more aggressive. The grading of cervical cancer cells looks at how abnormal the cells are and how much they differ from normal cells. Grade 1 cancers have cells that look more like normal cells and tend to grow slowly. Grade 3 cancers have very abnormal cells that grow and spread more quickly. This microscopic grading helps doctors predict how the cancer might behave and choose the best treatment options. Understanding these microscopic differences is essential because they influence diagnosis, staging, and treatment. For example, squamous cell carcinoma and adenocarcinoma are usually treated similarly, but rare types like small cell carcinoma may need more aggressive therapy. Recognizing the cell type and how abnormal the cells are allows healthcare providers to develop personalized treatment plans and improve outcomes. Always remember, if you have concerns about cervical cancer, consult a healthcare professional for personalized advice and appropriate testing.